As in, wala talaga ako na-feel. Hindi ako maka-get over. Ang gaan ng kamay ni Doc Mark. Ayan, check na yung x-ray ko. So it's the phase 2 part of my implant. Ano ba yung phase 2? So I'm not gonna explain that. Si Doc Mark papa-explainin natin. Hi, Doc. Yan. So this is Dr. Mark again. He will explain ano ba yung gagawin sa akin today.
Yes. So for today, we'll be placing the healing abutment. So, bali ito yung second surgical part, pero actually it's a minor surgical procedure. Parang slit incision lang on the area, so we can remove the cover screw, then we will replace that with the healing abutment. Yung healing abutment, that will be the component ng implant that will help form or remodel the gums around. So, para yung gums nung implant crown natin, mas more natural looking yung gum height niya.
So, injection, the needle, anesthesia, blade, and other basic instruments. Okay, so last time, yung sa last video ko, it took us around maybe 2 hours ata yun. Now, mabilis lang, Doc, no? Mga few minutes lang tayo.
Less than 30 minutes.
In the car on the radio, friends so disgusted, wonder how the hell they play it. Though secretly, you know they're gonna save it to their playlist. Dance to it alone and claim they hate it. Later be the one to say I like when they were nameless. Like I was listening before they were.
So maraming natatakot. They want to opt for an implant or kasi may mga missing teeth sila. Gusto nila magkaroon ng tooth doon na natural, looks natural, permanent, long-term. Implant is really the best, pero they are scared na ano ba, paano ba to, painful, yan, number 1 pain. May anesthesia kasi, so you really won't feel anything. Pag in-inject ka, it's gonna be numb the whole time during the procedure. But the after, depende na yan. So ito na, game. Let's go! Wala na siyang feeling. Hindi talaga siya masakit, promise. Okay, so what I do, I have a tip for you. I don't know if other patients do this. So yung tip ko, since Dr. Mark will tell me or dentists will tell you naman hingang malalim or what, so ayun na yung sign that they're gonna inject the anesthesia already. So what I do is, I use my nails para mag-carve ng, yan, no, you see it, that mark. This is more painful than the anesthesia. So, I trick my brain. I don't know, hindi ko alam. Pero yun yung mas painful so that I will not feel the pain here. Pero promise, even if I do not do that, yung this one, even if I do not do this, hindi talaga siya masyadong painful. You will feel something, but pain, hindi talaga.
From a movie scene to made up people in my dreams. The last time, if I recall, was a feeling of being alone. I don't know if where I'm going isn't far, but in case I go, no need to be stressed.
The abutment is there inside. 30 minutes, as in 30 minutes. We started around 1:48. It's already 2:19. 30 minutes. Very fast. Painless. As for me, it's painless. Hooray! Thank you at the Apple and Doc Mark.
It won't be too long till we arrive at coming day. Please ignore my presence.
So yung case ni Miss Elaine, we started with the condition ng bone niya is just around 2 millimeters. Ganito lang yung bone niya on the area. Actually, it's 1.59 millimeters. Yan. So, we cannot place the implant directly if the condition of the bone is like that. So, on this x-ray, we started the initial drill for sinus lift. Yan. So, after that, this instrument is blunt on the end. So, it will just push the sinus membrane. It will not perforate the sinus membrane. So, on this area, we pass through the bone. So, 1.59 millimeter of bone. So, we're now lifting the membrane on that area. So, as we can see on the x-ray that we're on the membrane already. So, it's now time to place the bone. So, on the next x-ray, we place the bone. So, initial increment. So, as we put some increments of 1 to 2 cc, 0.2 cc, we take x-ray. So, here we created a bone of 7 millimeters already. And we're planning to place an implant which is 5 by 8 millimeters. Yeah, so, we just need to extend more so that we'll be able to place the implant without that are completely covered with bone. So here we were able to place around 9.42 millimeters bone. So we decided that we can place the implant already. Here's the initial access of the implant. So we'll just try to insert it further to create the full seating ng implant bone level. So after that, we suture the area, place a cover screw on this area. And we waited for 6 months for the bone here to mature, maging monogeneous siya on the existing natural bone. Yan. So we recall Miss Elaine every month or every 3 months for x-ray. So as you can see, the bone here is starting to transform into the original bone. Here, there will be some changes on the crestal bone as integration happens. There may be some portions of loosening of the bone, but it's okay as long as the main body here is well integrated. So as you can see here, the bone level on this area is stable as to compared to the previous months. So that is a stable bone height. So there's no active infection in the area. So we can go about this and proceed with the prosthetophase. So right now, we put the healing abutment. So we'll wait for a week for the healing abutment to form the gums. Then proceed with the impression taking. So 2 more meetings to finalize the crown.
Hey everyone! I'm here together with the great Dr. Jonas Apostol, my husband. He will place the crown, the final crown. So, Dr. Mark is not here kasi kaya naman ni Doc Jonas na yan. So, he will cement. May mga sasabihin po ba kayo, Dr. Apostol?
Matakot. Huwag kang matakot.
Ayan, so wag lang daw matakot.
To made of people in my dreams. The last time, if I recall, was a feeling of being alone. I don't know if where I'm going isn't far, but in case I go, no need to be stressed. Gotta take it home, 'cause there I really miss shade of blue. Just take it slow. I'll wait to find love. Better hear the call again. For now I will feel the ocean view. And I pray that it won't be over soon. Oh my, I miss the sun. Just wait, it won't be too long to
mate na.
restless face, 'cause it's so hard to keep it all together ever since we left. I guess it just